It's KBKW's Coffee Talk. It is now 7:13, and with us for the next 20 minutes, we're going to have Sherry Torkos, who is a holistic pharmacist and author of more than a dozen books on natural health and healing. And we're going to be talking to her about when's the best time and what do you look for if you're going to take your children to the doctor or keep them at home and take care of them there, or send them to the doctor because you're not sure what's going on. And welcome to the show, Sherry.
Hi, good morning. Thanks for having me.
You bet. And, you know, one of the things is kids, they get high temperatures. They seem to get sick rather often. And so it can confuse parents, I think, as to how serious something is. And so that's kind of what we're going to delve into today, right?
Yeah, that's right. I think it is a stress for any parent when your child is sick. And even for myself as a pharmacist and having the background and the knowledge and the training, I remember very distinctly the first time my baby had a fever. And thankfully I was able to, take care of it at home and it didn't get into anything too serious. But I think as a parent, you always worry, when should I make that call? And so I want to share with your listeners today some of my tips and recommendations when it comes to managing fever, vomiting, diarrhea, coughs, colds, rash, all of these common childhood illnesses. In certain situations, you can manage them at home, and in some cases, taking a child to a doctor where you're exposing them to more germs, more bugs, maybe a long wait in the waiting room, that can actually be more problematic.
And so, and of course, you see this sometimes, too. As families, they have one child, and then they have the second and third, and they treat them a little different than they did the first because they're more in tune to what's going on. Now, what are the red flag signs of when you should take them to the doctor?
Right. Okay, so if we're talking about, fever for starters, which is a common occurrence, especially for children as their immune systems are developing and they get exposed to different viruses, bacteria. Fever is how your body naturally responds to fight back. Your body will raise the temperature, trying to fight off the offending organism. And my position as a pharmacist is to kind of be watch and wait, take their child's temperature using something accurate like an ear thermometer. I would stay away from the mercury thermometers, especially the glass ones. If you are using a standard type thermometer, use a digital one instead of the mercury and glass ones, because if they break, there's always that, exposure to toxicity. But a few guidelines to keep in mind when it comes to managing fever, and the first is to monitor it frequently. If you have an infant less than 3 months of age, if that temperature rises over 100.4 degrees, then you need to see the doctor, because infants with their new developing immune systems don't really have the ability to fight back as much as older children do, and that fever can escalate rapidly, and there's always the risk of seizures and more serious complications. So with an infant, you have to be a little bit more cautious. If you have an older child, say a child 5, 6, 7, 8, 9, in that age range, and they have a low-grade fever, it's 100, it's 101, 102, I wouldn't worry. I would just keep them hydrated, lots of fluids, unless they have other symptoms that are occurring at the same time, such as difficulty breathing. If they say their ear is, if they're pulling their ear and they're screaming, my ear hurts or my neck hurts, or there's a lot of vomiting, diarrhea along with the fever, that's more concerning. But otherwise, keep them comfortable, lots of fluids, juice, things like that, cool compress on the forehead, and usually these things will resolve, within a day or so.
Now, do they still put tubes in kids' ears? Because both of my children had to have tubes put in, and I felt really bad about my daughter because she would walk around furniture, but she was constantly having to hold on to things. And then but when it came to walking across a room, she would resist doing that. But she also had earaches, and so we ended up putting tubes in her ears within 1 day. She was walking without having to hang on to anything. And so when my son started having those, we put tubes in his ears too. But,
they still do that. In fact, it really depends. Some children have, the reason they do the tubes is for children that have very small, the tube is the eustachian tube we're talking about, and sometimes the angle of the eustachian tube, if it's not draining completely, as you noticed, it can affect their balance, their equilibrium. Also, if the ears are not draining properly, sometimes that you can get bacterial growth, repeated ear infections, and that can actually do a lot of harm in the long run because they'll need repeated courses of antibiotics. There can be hearing damage. So when it comes to tubes in the ears, it is still often done. It's a very safe practice, and it can actually make a big difference for kids that are really struggling with repeated infections or balance issues.
Yeah, because I felt really bad because all of a sudden she's walking, and I thought, whoa, wait a minute, because all this time we're saying now, let go, walk, and she just down on her butt she'd go, and so I thought that she was kind of resisting us, but that wasn't the case.
Yeah, exactly. Once you got that, I've heard so many parents tell me what a difference it makes once they get those tubes put in, and usually it's a temporary thing. They might be in a year or two, and then once the child has grown and the eustachian tubes are starting to mature, then they can be removed. So those are some guidelines when it comes to managing fever. Again, cool compress, lots of fluids, keep an eye on the situation. The next big area I wanted to talk about is unpleasant morning talk, but it's the digestive distress, it's the vomiting, the diarrhea, which are so common as well in these issues in children, because when a child has either eaten something that doesn't agree with them or they've come in contact with a virus or a bug, the body will react naturally by trying to rid itself of that offending organism. And so it's purging, it's eliminating, it's coming out of both ends sometimes. It's unpleasant for the child and the parents. But usually these things resolve quickly. The body will get back to normal in a day or so. But a few things that you can do to help support children that are experiencing upset stomach, tummy trouble, digestive distress, I would suggest giving them lots of fluids when they're able to keep something down. So same with fever, lots of fluids, always critical to prevent dehydration. And I would suggest looking for a solution, an electrolyte solution that's specifically made for children to prevent dehydration. So one that I often recommend is Pedialyte, or the generic store equivalent, CVS Walgreens brand, which are similar ingredients and composition. So that is essential to prevent dehydration. The other thing that I would suggest looking for diarrhea in particular, a lot of the things in the pharmacy are not recommended. The over-the-counter drugs are not safe to give children less than 6. One exception is a powder mix called Dia-Rescue, and that's a mixture of colostrum and egg solids, and it's actually been specifically studied for pediatric diarrhea in children. And I've done some consulting work with the company, and I had the opportunity to look at their science. It's very compelling, and it's something that can actually make a big difference. It's not stopping the diarrhea by slowing down the movement of the intestine. It actually works by supporting the body's own natural system, helping to restore balance. The colostrum, the egg solids, they have these important nutrients and immune factors that just work with the body's own underlying system to sort things out. So it's a great way to approach the problem. And it's, again, not a drug. It's considered to be a food for special dietary use. And if you give that Dia-Rescue, as soon as the child starts with the diarrhea, in most cases it will resolve it within a day or 24 hours. So that's big relief for the kid and also for the family. So I would keep that in mind. And when a child has had either vomiting or diarrhea, you want to keep them on a bland diet, nothing spicy, nothing too sugary or sweet. Stay away from those types of things. Bananas are always a good choice because of the electrolytes and the soluble fiber. It can help with both diarrhea and other digestive problems. In the past, we used to say give a little ginger ale, but today most of the ginger ale has no ginger in it, so I'm not a huge fan of that unless you get a real natural ginger ale or a ginger tea or something like that. Also, you can give a little coconut water because of the minerals and the electrolytes. That can be helpful, too.
Okay. Well, we need to take a really quick commercial break, and then we'll be back with you. And if you just tuned in, Sherry Torkos is with us, a holistic pharmacist and author of more than a dozen books on natural health and healing. And we'll be back with her in just a moment.
This is a joyful noise. Ho, ho, ho. This is not.
Don't let poor sleep suck the joy out of your holiday season. Use your remaining annual insurance benefits at Innovative Sleep Centers in Aberdeen. Call today to schedule a consultation or learn more at innovativesleepcenters.com. Make a joyful noise this holiday season.
Because good sleep is a reachable dream.
Sexual abuse happens every day.
If you or someone you know would like support, call Beyond Survival's 24/7 crisis line.
1-888-626-2640.
All calls confidential.
Would you like to provide a Christmas present to a Grace Harbor child in need? Christmas for Kids in Grace Harbor has donation barrels all around the harbor. Just bring your unwrapped gift or toy and drop it off in one of their barrels by December 15th. A few donation locations are Jodasha Broadcasting, Aberdeen Timberland Bank, Habitat for Humanity, and Aberdeen Office Equipment. For more info and locations, call Ramona at 360-580-6709. Drop on by and make a Harbor Kids Christmas great.
It's KBKW's Coffee Talk, and back we go to Sherry Torkos. And now, the elephant in the room right now is, I have a question for you, is what about, vaccinating children? There's so much controversy over that, but yet, you had the measles breakout all over the country. So what's your take on that?
Well, it is a tough conversation sometimes because people have different ethical and religious beliefs, and I always encourage families to have this discussion with their doctor, their pediatrician. There are a lot of benefits and pros when it comes to vaccination for, say, the flu and other viruses, especially for vulnerable populations, those that are elderly, immunocompromised, children as well, people that work in daycare settings, hospitals. So what I would say is, have that conversation with your healthcare provider, discuss the benefits, the pros, the cons, and regardless of whether or not you decide to get the flu shot, there are lots of things that families can do to support their immune systems to help to protect themselves against getting sick this time of year. So if we're looking at, some of my recommendations specifically for children, I like to encourage families to supplement with vitamin C and D this time of year. Vitamin D, the sunshine vitamin, very difficult to get enough of through sun exposure, and even in diet. We get such a little amount in diet. So vitamin D supplements I'm an advocate for because there is evidence to show if you're deficient in vitamin D, that can compromise your immune system, maybe increase your likelihood of getting influenza. Vitamin C, important, especially for those picky eaters in the house. Some children, I've heard parents say, my child won't eat any fruits and vegetables. And if, that's the situation, then I would suggest a good chewable vitamin C for the child. And also if you have adults in the house that are either a lot of stress, maybe not eating enough vitamin C-rich foods, anybody who smokes, they can be deficient in vitamin C, so those are some considerations. And also for prevention, echinacea, there's some good evidence that echinacea can help to protect against respiratory infections, and it's safe for those that are as young as 2 years of age. I
have a question, though. What strength, like for vitamin D and for vitamin C, how potent?
So for vitamin, it depends on the age of the person. So for an adult, for vitamin C, I would recommend anywhere from 500 to 1,000 milligrams. But for children, depending on their age, it could be 100 to 250 milligrams. Too much vitamin C can be hard on the stomach. There's a form of vitamin C that I recommend called ester C, which is buffered, so it's easy on the stomach. So that's one to check out. And with echinacea, there's also a wide variance in types of echinacea. I recommend echinacea purpurea because it has been clinically researched, and that dosage there would range probably in the neighborhood of 400 to 1,200 milligrams a day.
What about vitamin D?
Vitamin D for an adult, depending on a few factors, your health, your lifestyle, any existing conditions, I may recommend anywhere from 1,000 units up to 5,000 units. And in some patients, I do go even a little bit higher, depending on their health factors. So that's kind of a ballpark range, but 1,000 units for an adult would be the minimum I'd recommend.
Yeah, see, in our house, it's 2,000, which should be adequate then?
Yeah. 2,000 is totally fine. I take 3,000 myself, so 1,000 was, again, kind of the minimum amount. It's a good idea, too, to get your vitamin D levels checked and to make sure what you're taking is being absorbed by your body. There's certain people that are more likely to have deficiencies, such as people that have celiac disease, Crohn's, colitis, irritable bowel, digestive problems. Also, some people that have liver and kidney issues can also be deficient in vitamin D.
Now, of course, because we're getting down toward the end of our time here, you also have numerous books that you've written. Kind of fill us in on what you've got available to folks.
Yeah, for sure. I'll give your listeners my website as well. You can find information on my books and also the topic we were discussing today, when to make that call, where I provide guidelines on managing fever, digestive issues, cold, flu, and all of these things. There's a blog page. If you go to SherryTorkos.com, it's SherryTorkos. If you go to my blog page, you can take a look at my recommendations. I also have my books. I've written an encyclopedia of natural medicine. I have a book on women and heart disease, glycemic index. You can access a lot of great information through my website and also look at some of my recent TV interviews and read more about what I do.
Now, if a person wants to buy your books, what would you suggest for them to get first?
Well, I would actually, if you go online to Amazon, you can actually get an electronic version of my health encyclopedia. And I find a lot of people prefer that versus the paperback or the hard because they have it on their computer. They can bring it up. They can access my recommendations. So say they're facing colds, coughs. Maybe they want information on menopause or prostate issues, arthritis, diabetes, heart disease. It's an A to Z reference guide, and it's just packed full of great information on both the conventional approach, so the medical interventions, as well as the natural dietary supplements, things like that.
Okay. Well, we're gonna have to let you go now because we're out of time. But thank you very much for taking time out to speak with us today.
Yeah, thank you so much. I appreciate it. Have a great day.
You too.